Assalamualaikum. My name is Nadia, and the topic that I'm going to present today is mental health. The contents of my presentation are what is mental health, the risk factors for mental health conditions, the types of mental health disorders and early signs, then the diagnosis and treatments of mental health disorders, some myths and facts about mental health, and lastly, I'll tell you about how to maintain your mental health. Here is a brief introduction to mental health. Mental health, it is important for an individual to be mentally stable. So it is a fundamental right of a human being or of an individual to be mentally stable. As much as your physical fitness is important for you, likewise your mental fitness is also important for you because all the daily life activities depend upon your mental health. So mental health refers to cognitive, behavioral, and emotional well being. It is all about how people think, feel, and behave. The way you talk, the way you behave, the way, all tells about how your this everything tells about your mental status. So, if you are mentally fit, you will be able to cope up with all the stresses of life easily. So, people sometimes use the term mental health to mean the absence of a mental disorder. So, if you aren't having any kind of mental disorder, anxiety, or stress, that means you are mentally stable and mentally fit. Then, what is mental health? So, according to the World Health Organization, mental health is a state of mental well being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. So, if you are stable mentally, if you are mentally healthy, you'll be able to cope with the stresses of life no matter how much burden is put onto you, you'll be able to cope with it, you'll be able to work well. So, if you aren't fit mentally, you won't be able to cope with the stresses of life. If you are mentally fit, you'll be able to realize your abilities, you'll know your worth, and you will be able to utilize your qualities for the benefit of the community. So you'll be able to automatically you'll be able to contribute to your community. So it also emphasizes that preserving and restoring mental health is crucial individually and at a community level. So mental health is not only important for an individual, but for at a community level it is important for all of us to make sure that all the individuals of the community that we are living in, they aren't going through any kind of stress or trauma. If even if they are going through, we should go and help them, we should ask them and provide them any kind of help or support that we can, so that to make sure that no one is having a bad mental health. Here is a percentage of how much adults experience mental health problems each year. So, in the United States, the National Alliance on Mental Illness estimates that almost 1 in 5 adults experience mental health problems each year. In the 2020, an estimated 14.2 million adults in the US, or about 5.6%, had a serious psychological condition, according to the National Institute of Mental Health. So, this is a percentage of how much adults experience mental health problems each year. Then the risk factors that are associated with the mental health conditions. The risk factors include biological factors, means there can be some kinds of genes whose absence can cause mental health disorders. There can be any kind of childhood adversity such as parental loss or any trauma that you have been going through since childhood. Continuous social and economic pressure, the pressure or the stresses that are put on you, they can also damage your mental health. Environment, then the environment that you live in, and if the environment that you live in isn't friendly enough, so you'll automatically be having a bad mental health. Negative thoughts and stress. Continuous social and economic pressure. Having limited financial means can increase the risk of mental health disorders. If you are having limited financial means, you'll be stressed about all the things that you'll have, all the responsibilities that you'll have to fulfill. So that puts a lot of stress onto you. So that automatically it damages your mental health. The researchers found that being female increased the risk of low mental health status by nearly 4 times. So, females have a weak mental health or a low mental health, have a low mental health by nearly 4 times than males. So, according to gender, this is gender-wise, that how much mental health, the state of mental health the state of mental health of a female versus a male. So the females have a nearly 4 times low mental health than males. Then people. with a weak economic status also scored highest for the mental health condition in this study. So a weak economic status will put a lot of stress for onto you, that you have a lot of responsibilities to fulfill, so the stress automatically affects your mental health. Then childhood adversity is any kind of childhood trauma that you went through, or a parental loss, parental separation, significantly affect a growing child's mental and physical health. So that affects your mental health, and that can result in a lifelong trauma. So the childhood adversity affects your mental health. There are biological factors that includes genetic family history can increase the likelihood of mental health conditions, as specific genes and gene variants put a person at a higher risk. Having a gene associated with a mental health disorder does not guarantee that a condition will develop. Likewise, people without related genes or family history of mental illness can still have a mental health issues. If you are having a gene, or if you are having a gene that is associated with any kind of mental health condition, that means you can develop a mental health condition too. But this does not completely depend upon having a gene. You can also develop a mental health condition even if you are not having that certain gene. So that this does not completely depend upon the gene. When chronic stress and mental health conditions such as depression and anxiety may develop due to underlying physical health problems such as cancer, diabetes, and chronic pain. The physical health problems can also affect your health conditions, mental health conditions like cancer, diabetes, and chronic pain. So these physical health problems they also affect your mental health conditions. Then the types of mental health disorder, these are some types. These are anxiety disorders, mood disorders, and schizophrenia disorders. Anxiety disorders, according to the Anxiety and Depression Association of America, anxiety disorders are the most common mental illness. These are the most common. Then people with these conditions have severe fear or anxiety related to certain objects or situations. Most people with an anxiety disorder try to avoid exposure to whatever triggers their anxiety. There is a certain trigger that there is a certain means certain situation, or certain there are certain objects that trigger anxiety. So the people and the people that have anxiety disorders, they avoid such kind of exposure to such kind of objects or situations that trigger their anxiety. So they avoid social gatherings, because these kind of people, they cannot express their thoughts easily in such kind of situations. So people with anxiety disorders, they avoid exposure to such type of situations or environments that trigger their anxiety. And then these are the examples of anxiety disorders. These are generalized anxiety disorder. They involve excessive worry or fear that disrupts everyday living. These include means a person goes through fear and stresses every day. Then people also experience physical symptoms including restlessness, fatigue, poor concentration, tense muscles, interrupted sleep, and a bout of anxiety symptoms. So these symptoms appear when a person has generalized anxiety disorder, but the person can also be asymptomatic. So a person can have generalized anxiety disorder even if these symptoms may not appear. So the person can also be asymptomatic. Then panic disorder. People with panic disorder experience regular panic attacks involving sudden overwhelming terror or a sense of imminent disaster and death. So, uh, in this disorder, a person regularly goes through panic attacks, and it also comes under anxiety, but it is the anxiety develops into a chronic stage. So the person experiences regular panic attacks. Then the phobias, there are different types of phobias. There are thousands of phobias that exist, that depends upon person to person. Everyone can have different phobias. One thing that appears to be normal for a person can be a trigger for anxiety for the other person. So phobias, they are completely different for different people. Simple phobias, they may involve a disproportionate disproportionate fear of specific objects, scenarios, or animals. A fear of spider is a typical example. Then social phobia, this is also known as social anxiety. In this, the people avoid social gatherings because it is they kind of induce fear into them. so people avoid such environments. The phobias are deeply personal, and doctors do not know every type. There could be thousands of phobias, and what may seem unusual to one person can be a severe problem that dominates daily life for another. OCD, people with obsessive compulsory disorder have obsession and compulsion. In other words, they experience constant stressful thoughts and a powerful urge to perform repetitive acts such as hand washing. You can see in this GIF that have added into this presentation that people with OCD they have obsession with specific tasks or specific acts which they perform repeatedly in OCD. So and that's how OCD is. Then PTSD can occur after a person experiences or witnesses an intensely stressful or traumatic event. And during this type of event, the person thinks that their life or other people's lives are in danger. They may feel afraid or that they have no control over what is happening. So it is also kind of traumatic event. A person goes through traumatic event, so this affects their mental health and it induces fear into the person. Then mood disorders, people with these conditions have significant mood changes, either a period of high energy and joy or depression. Examples of mood disorders include major depression and bipolar disorder. Major depression, a person experiences a constant low mood and loses interest in activities and events that they previously enjoyed. They can feel prolonged periods of sadness or extreme sadness. So, the person loses interest in their daily life activities because of their low mood and constant low mood. Then, bipolar disorder, a person with bipolar disorder experiences unusual changes in their mood, energy levels of activity, and ability to continue with daily life. Periods of high mood are known as manic phases, while depressive phases bring on low mood. So in bipolar disorder there are unusual changes in the mood. There is a time when the person is when the energy level of the person are on the peak, but then there are times when the person the person's in the energy level hit low level. So these are the unusual changes in the energy levels or unusual changes in a person's mood. Then seasonal affective disorder, this depends upon the season. So the people with seasonal affective disorder, for them the daylight acts as a trigger for anxiety. So reduced daylight during the fall, winter, and early spring months triggers this type of major depression. It is most common in the countries far from the equator because the daylight there is very dim. So it acts as a trigger for the people with seasonal affective disorder. Then schizophrenia disorders. The term schizophrenia often refers to a spectrum of disorders characterized by psychotic features and other severe symptoms. These are highly complex conditions. These are complex or chronic conditions, we can say. According to the NIMH, signs of schizophrenia typically develop between the ages of 16 and 30. The individual will have thoughts that appear fragmented and may also find it hard to process information. So this is a complex condition which the person isn't even able to process the information. Then schizophrenia has negative and positive symptoms. Positive symptoms include delusions, thought disorders, hallucinations, while withdrawal, lack of motivation, and a flat or inappropriate mood are examples of negative symptoms. In positive symptoms, the person has hallucinations or feelings of euphoria or well-being, while the negative symptom, the person loses interest in activities and lack of motivation and inappropriate mood. A person goes through inappropriate mood. And the early signs include withdrawing from friends, family, and colleagues. As I told you earlier, that the person avoids social gatherings, avoiding activities that they would normally enjoy, sleeping and eating too much or too little, feeling hopeless, displaying negative emotions, having consistently low energy, being unable to complete daily tasks such as getting to work or cooking meal, using mood altering substances including alcohol and nicotine more frequently, having persistent thoughts or memories that reappear regularly, thinking of causing physical harm to themselves or others. A person if isn't having a good mental health, so and he'll obviously need to find a way out to get out of all the stress. So the person then starts thinking of causing physical harm to themselves or others, then hearing voices and experiencing delusions. Diagnosis. There are two ways to diagnose mental health problems. Firstly, to identify the trigger, that what's the trigger that's inducing stress or that's causing a person to have a bad mental health. And the second is the symptoms that you feel. That we can diagnose it through the symptoms that appears. Then the diagnosis can be made through two processes. A doctor may begin by looking at a person's medical history and thorough physical exam to rule out issues that may be causing the symptoms. The doctor checks the patient's medical history to check whether the patient is having any kind of physical health physical health diseases or conditions that are causing stress or biological disorders. So no medical test can diagnose mental disorders. Then the symptoms include they will also do a psychological evaluation. This includes asking about a person's symptoms, experiences, and how they have impacted their lives. That they'll ask whether the person has gone through any kind of trauma in the past. And then the doctor may ask a person to fill out mental health questionnaires to get an idea about a person's thoughts, feelings, and behavior patterns. And there are people sometimes they aren't able to express their feelings. So for this purpose, the doctor asks them to fill out a questionnaire so that they can get an idea of what what the person is feeling or what is going through their mind. The doctors may order a series of laboratory tests such as imaging exams and blood work to screen for other possible underlying causes or diseases that may cause the symptoms or that may cause the bad mental health. And the mental health is as important as physical health, as I told you earlier, that as a person's physical health is important, likewise your mental health is also important. Then the treatment of mental health disorders. There are various methods for managing mental health problems. They are highly individual, and what works for one person may not work for another. Below are some treatment options for people with mental ill health. Then psychotherapy or talking therapies, you can treat a person having mental health by consoling them, by having talking therapies with them, so the person is able to express what's going in their mind and to share their feelings with you. This would reduce the burden that they are having. This type of treatment takes a psychological approach to treating mental illness. Psychiatrists, psychologists, psychotherapists, and the primary care physician carry out this treatment. It helps people understand the root of their mental illness and start to work on more helpful thought patterns that support everyday living and reduce the risk of isolation and self-harm. So when we console them and when we talk to them and to the people having mental health disorders, so this reduces their risk of isolation, so and self harm. So if they aren't having a good mental health, so they automatically they'll isolate themselves from their friends, family, and everyone, and they'll think of harming themselves or to other people. So that's how, if we talk to them, if we console them, so this will reduce their stress and they won't think of harming themselves or isolating themselves from their friends and family. Then medication also works in treatment of mental health disorders, then such as antidepressants, antipsychotics, and anti-anxiolytic drugs. Although these cannot cure medical disorders, some can improve symptoms and help a person resume social interaction and a routine while working on their mental health. Medications, they cannot wholly solely means they cannot completely cure your mental health disorders, but they can reduce your symptoms and they can help you cope with your stresses and reduce the extent of stress. So they cannot completely finish the stress that you are going through, or they cannot completely cure your mental health disorders, but they can reduce their extent. Some of these medications boost the body's absorption of feel good chemicals such as serotonin from the brain. Other drugs either boost the overall level of these chemicals or prevent their degradation or destruction. So serotonin, this makes you feel good, So these medication, they boost their body absorption of feel good chemicals, automatically reduces the level of stress. In self-help, a person's coping with medical difficulties, mental health difficulties may need to change their lifestyle to facilitate wellness. Your lifestyle also have a huge impact on mental health, so that's what you can do individually for yourself. If you're going to a bad mental health, so you should change your lifestyle. If there's something wrong with your lifestyle, you should opt for changing it. Then such changes include reducing alcohol intake, sleeping more, and eating a balanced diet, nutritious diet. Insomnia, it is also a main cause of a bad mental health. Your body needs proper sleep, your brain needs to rest. So insomnia is also a cause of having a bad mental health. So if you are insomniac, you should go for good sleep, and that's what you can do individually for your own mental health. People may need to take time away from work or resolve issues with personal relationships that may be causing damage to their mental health. Healthy relationships are important because if there's something wrong with your relationships with your family, friends, or whatever they are, so you should go and resolve the issues, and that would help you relieve your stress. People with conditions such as anxiety or depressive disorder may benefit from relaxation techniques, which include deep breathing, meditations, and mindfulness. Meditations also reduce your stress. Then these are some myths and facts. Myths include teenagers do not have mental health issues, they just have mood swings due to their fluctuating hormones. Yes, teenagers do have mental health issues. The fact still remains the fact that teenagers have mood swings, but they also can have mental health issues. Half of the mental health conditions begin by the age of 14. So this is a myth that teenagers do not have mental health issues. They have them. Psychiatric medications are harmful. No, psychiatric medications are not harmful. People just find excuses so that they cannot they don't have to take medications. So mental psychiatric conditions, they aren't harmful. They help you relieve your stress. They lower the extent of your stress. So you should not avoid taking psychiatric medications. People with mental health need cannot keep and perform well in a job. This is a myth because people with mental health, they can perform well if they are exposed to a friendly environment. If your environment is not friendly and you are already having a bad mental health, so that would worsen your mental health. So this is a myth that says that people with mental health conditions, they cannot keep and perform well in a job. They can if they are exposed to a friendly environment. Take care of your How can you take care of your mental health? By regularly exercising, performing relaxing activities such as meditations, deep breathing, good quality sleep, eat a balanced diet, and stay hydrated. And that's the end of the presentation. Thank you for your attention.